Hello, I'm John Barlow from Mayo Clinic. I'm an orthopedic surgeon who specializes in shoulder and elbow surgery as well as trauma surgery. Today I wanted to talk to you about one of my favorite topics in all the world, and it's very, very common. In particular, it's something in which a lot of people, patients that I see, have a lot of misconceptions, and that's the rotator cuff. So what I'd like to talk to you about today is what I call Rotator Cuff 101. It's 5 facts in 5 minutes that tell you about the rotator cuff, everything that you need to know. First of all, the rotator cuff is actually 4 muscles that turn to one tendon. The reason we call it a cuff is because it looks just like the cuff on my shirt sleeve. It turns into a sleeve of tissue that is a tendon of all 4 tendons. The muscles are the subscapularis in the very front of the shoulder, the supraspinatus on the top of the shoulder, the infraspinatus high up and in the back of the shoulder, and the teres minor lower down in the back. Those 4 muscles turn to one tendon that is called the rotator cuff. The second point that I want to talk about in regard to the rotator cuff is the biceps tendon. It's always a little bit surprising when people come into my office and I start to talk about the biceps tendon. The biceps tendon is called the biceps because it has 2 heads. One of those heads runs right through the rotator cuff. It splits between the subscapularis and the supraspinatus tendon. That tendon and that location, as you can imagine, can be problematic. Sometimes it's just causing pain in the shoulder, but in other situations, it can actually be contributing to a rotator cuff tear itself. That's most common in the subscapularis tendon in the front of your shoulder. The third important point to know about the rotator cuff is probably the most important of all of these points. Rotator cuff tears are normal. Just like getting gray hair or losing our hair as we get older, we all have rotator cuff tears. It starts as really a degenerative process where the tendon is breaking down over time. What is not normal is to have shoulder pain related to a rotator cuff tear. That's where we really make a critical distinction. So rotator cuff tears are normal. Pain in the shoulder is not normal. The fourth point is that almost all rotator cuff tears originate in the same spot. We talked about that pesky biceps tendon that runs through the shoulder. Most tears originate about 1 centimeter behind that, in the supraspinatus tendon. And almost all of these tears start as tears of the tendon off the bone. So that's how tendon tears begin, tearing the tendon off the bone. As that tear enlarges, it involves more of the supraspinatus and then even the subscapularis and infraspinatus. So that determines the size of the rotator cuff tear. But almost all of them start in the same spot, right behind the biceps tendon. The fifth and final point, most rotator cuff tears, 80% in some series, can be treated without surgery. As we discussed, the pain is the problem, not the tear in the rotator cuff. So without surgery, with physical therapy, most of the time, a home program done by yourself at home, you can get over this rotator cuff-based pain. It doesn't cure the tendon tear, but it can dramatically decrease the amount of pain that you have in the shoulder. So we almost always start with non-operative management for rotator cuff tears. Those are my 5 high points of rotator cuff tears. There's 4 muscles that attach to a tendon that turns into a cuff of tissue. The biceps tendon is a pesky tendon that bothers the rotator cuff and can cause substantial pain. Rotator cuff tears are normal. They happen in everybody as we get older. Almost all rotator cuff tears originate just behind the biceps tendon and the supraspinatus. Finally, almost all rotator cuff tears we can get better without surgery. Look forward to future videos in which I talk about how to make your rotator cuff pain better. What are some things that are worrisome that would indicate that we should do surgery rather than continue with non-operative management? What does surgery look like? And how to get through surgery and get the best outcome after surgery. Thank you for your time.